Good morning, everyone, and welcome to our special virtual media event. Can you all hear me?
I think everybody's on mute.
Okay, well, can you hear me? My name is Emily, and welcome to our special virtual media event featuring Dr. Soren Rodning and Dr. Mac Devin, who will talk about the issue of trichomoniasis and the drought in Texas. Dr. Rodning provides food animal agricultural support as an assistant professor and extension veterinarian in the Auburn University Department of Animal Sciences and the Alabama Cooperative Extension System. Current extension efforts primarily involve promoting reproductive and herd health management for beef cattle. Dr. Rodning's research focus is investigating the epidemiology of several bovine pathogens, including evaluating the efficacy of various preventive and control procedures from common bovine diseases such as BVD, trichomoniasis, and anaplasmosis. After earning his bachelor's degree, Dr. Devin was engaged in the cow, calf, and stocker business for 12 years. After earning his DVM, he practiced general veterinary medicine with emphasis in cow, calf, stocker, and feed yard medicine. Dr. Devin joined Fort Dodge Animal Health in 1997 as a professional services veterinarian. He became part of the Boehringer Ingelheim Vetmedica, Inc. team in the fall of 2009. During their presentation, we encourage you to ask questions along the way. You can do this by typing them into the box located in the questions section of your control panel. Afterwards, I'll facilitate a question and answer period with the questions collected during and after the presentation. If at any time you experience technical difficulties, you can just call Amanda Solman at 612-617-7958. Follow-up interviews can be scheduled through Lori Maud at lmaud@broadheadco.com or by calling her at 612-617-7932. And her information will also be available at the end of the presentation for you to write down then. So without further ado, I'll hand it over to Dr. Devin as he begins the presentation today.
Well, good morning, everyone. And again, thank you for being in attendance on this first webinar event. We're pleased that you're here, and we look forward to hearing what Dr. Rodning will have to share with us today. Dr. Rodning is a young man that I've come to appreciate a great deal for his knowledge, his expertise, and his general demeanor as a gentleman in the veterinary profession. And so I'm glad to have him here to share with us today. So let's look at a little bit about what we're going to talk about. We're going to talk about why reproductive efficiency matters, look at how trichomoniasis impacts that reproductive efficiency, and then talk about control and prevention of trichomoniasis just a bit. You know, we think back over the last couple of years with severe drought we've had in Texas and elsewhere, in the last year in particular, a lot of cows have changed hands, and as cows change hands, diseases move. And so consequently, even though many of those cows left the state and didn't come back, we will at some point be able to grow more forage than we have cows for here in this state, and we'll be back to bringing cows back. So as we do that, then we need to think about the disease consequences of that, and particularly in a cow-calf operation, how that impacts reproduction, because reproduction is probably the strongest measure of profitability on a cow-calf operation. So that's what we're going to talk about today. But in particular, we need to remember that those open or late calving cows, regardless of the cause, cost us a lot of dollars. We're in the situation where we've got minimal numbers in our state. Herds are smaller, and therefore cash flow is smaller. Expenses are probably up because of buying external feed, and certainly protein supplementation is costing more. Corn is much higher, and so all of those things really are challenging the cash flow to our ranching operations here in Texas. And so getting those cows to bring the calf to the pens at weaning time is extremely, extremely important. And even without the drought, it would still be important in terms of profitability. So as we kind of set the stage for this now, thinking about the importance of reproductive efficiency, I'm going to hand this over to Dr. Rodning and let him take it from here.
Thank you, Dr. Devin, and good morning, everyone. So as Dr. Devin mentioned, a major factor in the economic viability and stability of any cow-calf ranch is reproductive efficiency. A beef cow really needs to produce a calf every year to be an economically viable member of the herd, And this slide demonstrates how changes in weaning rates impact ranch profit per brood cow. And cows results in more calves weaned, which directly influences ranch performance and profits. And another important consideration when evaluating herd reproductive efficiency is calving distribution. In other words, when are calves born over the course of a calving season? All other things being equal, cows that calve early in the calving season, such as those cows that calve on, say, day 0 in the chart you see in front of you, are going to produce calves that are heavier at weaning simply because of more growth time. And the bottom line is that more pounds of calf at weaning is going to mean more money on sale day, and that's the driving factor behind the economic profitability of any cow-calf ranch. So without a doubt, reproductive efficiency is a key determinant in the economic viability of a cow-calf operation. Unfortunately, as Dr. Devin alluded to a little bit ago, there are many things that can negatively impact reproductive performance, both infectious and non-infectious. And just one infectious cause of poor reproductive performance is a disease called trichomoniasis, or trick. So let's talk for just a few minutes about what you would see in an animal and even in a herd infected with trick. It's important to keep in mind that trick is a sexually transmitted disease that can cause substantial reproductive and economic losses in cow-calf operations that use natural service. So the disease is spread through infected bulls. Bulls can become chronic, asymptomatic carriers of trick, and it's these infected bulls that spread the disease to susceptible cows and or heifers. So while the bulls simply serve as asymptomatic carriers with no noticeable clinical signs, it's the cows that actually suffer the identifiable consequences of infection. Infections in cows can result in early embryonic death, abortion, pyometra, which is a pus-filled uterus, often detected at pregnancy examination, like what you would see here in the bottom right-hand corner of the slide, and it can also cause infertility, all of which will negatively impact the reproductive performance and economic profitability of a cow-calf ranch. And again, if a cow doesn't produce a calf every year, she's not an economically viable member of the herd. She's a drain on resources. She is consuming resources without contributing to ranch income. So remember that trick only occurs in the cow after mating with an infected bull, and the resulting infertility due to early embryonic or fetal death is going to be the most economically damaging problem and will occur in a large percentage of infected cows. If they don't have some disease resistance, some immunity at the time of exposure, most cows will lose that fetus or that embryo. And while most embryonic and fetal losses associated with trick occur during the first trimester, a small percentage of cows will abort in the second and sometimes even in the third trimester. Now, an important distinction between cows and bulls is that unlike the bull, the cow is usually capable of mounting an effective immune response to trick and can usually clear an infection in 2 to 6 months, sometimes longer, but usually within 2 to 6 months. However, they usually don't clear the infection before sustaining some type of reproductive loss, as we just talked about. Now, there are a small number of cows, it's estimated to be probably less than 1%, that will maintain an infection through a normal gestation and deliver a live calf. And even though they're small in number, these few cows that maintain a trick infection throughout gestation are really very damaging because they're hard to find and they represent a source of reinfection for the herd during the following breeding season and will absolutely wreck efforts to control the disease to a full extent. I just recently worked with a large trick-infected herd in Alabama in which the owner decided to cull all his bulls and replace them with virgin bulls to ensure that they were trick-free. And while he had a much better calving rate the following year, we still went through and tested all the bulls that he had replaced his herd with, And we found more trick-positive bulls because he had some carrier cows that had reinfected the bull battery. So anything we can do to facilitate clearance from infected cows is beneficial, and we'll discuss that in more detail in a minute. But it's very difficult to find these chronically infected cows because they truly are a needle in the haystack, and some of the diagnostics that we have available can make it that much more challenging. So anything we can do to facilitate clearance of the infection from the female reproductive tract is going to be very beneficial for control efforts. So what are you going to see in a herd that's infected with trick? Of course, we've talked about the early embryonic death, infertility, and the repeat breeding, and all that can result in long, drawn-out calving seasons, or what someone would refer to as a strung-out calving season. What happens is that a cow in a herd with a long breeding season can become pregnant and infected with trick early in the breeding season, lose that embryo or fetus, be infertile until she clears the initial trick infection, rebreed, conceive, and then as a result of her temporary immunity, because she's already been exposed to the disease recently, she can then carry a calf to term. And the result is that more cows will calve later in the calving season than desired, and then you're going to have that resultant wide variety in weaning weights like we discussed earlier, in addition to just an overall reduced calving percentage. Because a lot of the cows that are exposed to this disease, they're just not going to calve at all. And if they do calve, a lot of times they'll calve later than what would be ideal. And the later born calves are then going to be marketed at lighter weights and thus generating less revenue for the ranch or farming operation. And then further adding to the problem is that once a cow calves late in the calving season, it's just not very often practical or even biologically possible to adjust her calving date to a more profitable time early in the season. So once a cow calves late, she will likely continue to calve late in subsequent years, and thus sacrificing valuable growing time for her calf before sale date for the rest of her life. And as we discussed earlier, less growing time means fewer pounds to sell. So even a late calving cow, even a cow that's exposed to trick but still somehow manages to rebreed and carry a calf to term, even a late calving cow is going to produce less profit, not only the year she's initially infected, but likely every year subsequent to that, as compared to what the profit she would produce if she calved early in the season. And then, of course, cows with no immunity to trick, once they're exposed, if they calve at all, they're going to calve late. But more than likely, if they have no immunity, the majority of those animals are going to not calve at all. So the economic impact of trick is really due to four factors. One, you're going to have loss of calf crop because the calves are just not going to be born. The cows are not going to be able to get pregnant and stay pregnant and deliver a live calf. So you're going to have a loss of calf crop. Then you're also going to have the costs associated with culling open cows and infected bulls, along with the associated cost of then having to replace all that valuable breeding stock. And then there's also loss of income due to lighter weaning weights, which again results from the delayed conception and late calving. And since calves are born later in the season, they're going to be obviously sold at lighter weights. So how do we treat, control, and or prevent trick? As we discussed earlier, trick is usually self-limiting in cows and heifers since they typically clear the infection in 2 to 6 months, although again, usually not before sustaining some type of reproductive loss. And this is as opposed to bulls that typically become chronically infected. Now, unfortunately, one of the complicating factors associated with trick is that there are currently no effective treatments with Food and Drug Administration approval. So we have no FDA-approved treatments for trick. And so infected bulls that are typically chronically infected, they stay infected for their entire life. These infected bulls must be culled and then sold for humane slaughter only. And this lack of effective approved therapies for trick really emphasizes the need for appropriate prevention and control measures through education, testing and culling of infected bulls, raising herd immunity through vaccination in the event exposure does occur, and a variety of other good herd management practices. it's really important to remember that prevention and control of trich should focus on reducing the likelihood of infection or decreasing the level of exposure through herd management and good biosecurity, while using vaccination to increase disease resistance in the event that exposure does occur. So we want to obviously prevent exposure if possible. That will be the ideal situation, as Dr. Devin alluded to earlier. As animals begin to return to Texas, hey, what are some things we can do to prevent introduction of disease? So by far and away, we want to prevent exposure to trich if possible. But we also want to make sure that herds have a second line of defense with good immunity in the event exposure does occur. So that would include proper vaccination against the disease so that they're not completely naive the first time they are exposed if the disease does enter the herd. Now, not all the recommendations you see listed here are going to be practically feasible or even necessary based on geographic and production realities, but might be applicable in some situations. Now, vaccinating all breeding age animals, cows and bulls, against trich, as I mentioned earlier, is going to raise a herd's immunity and reduce the duration of infection and therefore mitigate the reproductive waste that's caused by trich. Obviously, the best thing we could do is prevent the disease from ever getting onto the farm, but that is not always going to be possible. And so if the disease does enter a farm, the next best thing we can do is have some line of defense, and that line of defense would be appropriate herd immunity through vaccination. So in my opinion, vaccination is a critical management tool in herds, certainly with high risk of exposure to trich, in order to promote the development of immunity or disease resistance against the organism. And failure to vaccinate high-risk herds will, without a doubt, increase the likelihood and severity of serious negative reproductive and economic consequences following infection of naive cows with trich. And then, of course, vaccination will also be recommended for herds even at moderate risk of exposure to trich. So by far and away, do the best you can do to prevent it from getting on the farm, but have a second line of defense in case it does, because if there is no second line of defense, the consequences will be absolutely devastating. So because trich is a venereally transmitted disease and affects the cow's reproductive tract, immunity to the disease is primarily driven by antibody. And the information presented here is from the licensure trial for a vaccine called TrichGuard V5L, which provides protection against trich along with some other reproductive diseases. And in this study, an attempt was made to evaluate the efficacy of the vaccine in the face of an absolutely overwhelming exposure. There were 120 heifers in the study, half of which were vaccinated, half of which were not vaccinated, and then 12 naturally infected bulls were used to breed the heifers. And additional trich organisms were introduced into the prepuce of each bull, both when they entered and or left the females on weekly intervals. And all the bulls were infected, which is not usually the case in trich-infected herds. But again, I just want to emphasize the point that this was an absolutely overwhelming exposure for this vaccine trial. This is not what we would typically see in a naturally infected trich herd. The bulls were all infected with the disease, which is not something we would normally see, and they were reinfected as the breeding season went on. So an absolutely overwhelming exposure. What happened subsequent to that was the heifers were carried out to full term, and as you see over here on the right-hand side of the slide, roughly twice as many calves were born to the vaccinated heifers as to the unvaccinated or the unprotected heifers. So twice as many calves from the vaccinated heifers as compared to the non-vaccinated heifers. Again, in the face of an absolutely overwhelming challenge, I think that is proof positive of good vaccine efficacy. Now, the information you see here is from the same trial, and what they did is 10 heifers from each group, both the vaccinated and the non-vaccinated group, were cultured for the presence of trich organisms in the vagina. And it's important to note that while the infection rates at week 1 were fairly similar between the vaccinated group here in the black and the non-vaccinated group here in the gray, by week 2, by week 2, the rate of infection in the non-vaccinates was much higher. So apparently one benefit of the vaccine is that it helped vaccinated heifers clear the infection from the reproductive tract much more rapidly than clearance in the non-vaccinated heifers. So in this case, the vaccine did a nice job helping these heifers clear the infection and hopefully in time to maintain their pregnancies to term, which was demonstrated by the previous slide and by the fact that twice as many vaccinated heifers gave birth to live calves compared to non-vaccinated heifers. So the information here is from a more recent study published in 2010 investigating the use of the vaccine in bulls. And prior to publication of this trial, we really didn't have much data on the vaccine's efficacy in bulls. There's always a lot of discussion about whether or not to, do I vaccinate bulls, do I not vaccinate bulls? But in this study, bulls that were 4 years old and older were used because it has generally been thought that older bulls are more prone to chronic infections. Certainly any age bull can become chronically infected, but for some reason older bulls tend to have a greater likelihood of becoming chronically infected. And so bulls were vaccinated, and then if you look down here at the bottom of the chart in the vaccine challenge group, they were vaccinated. They were vaccinated using the 2-dose regimen, and then exposed to a fairly high number of trick organisms. And then if you look, going out to 6 weeks post-exposure, there were no bulls that tested positive for trichomoniasis. So provided good evidence that, hey, that the vaccine does provide some protection in bulls. So this was a good study to give us something to fall back on when folks ask the question, hey, does the vaccine do any good for my bull? And I would say this provides evidence that, hey, yeah, the vaccine does provide some efficacy in bulls. So at this time, I'm going to turn things back over to Dr. Devin to discuss more details about the proper use of vaccination to protect herds and animals against trichomoniasis.
Well, thank you, Dr. Rodning. That was an excellent discussion about the effects of trick. And I have the good fortune of working for Boehringer Ingelheim, and we do make the trick vaccine. We make TrichGuard, and then we make a combination product there, TrichGuard V5L, which does contain Vibrio and Lepto as well. These are wholesale killed vaccines. They're very safe to use in pregnant cows. And depending on the product you're using, it's either a 2 or a 5 ml dose. The TrichGuard by itself is 2. TrichGuard V5L is 5. And the label recommendations are as a booster dose, initial dose followed by a booster 4 weeks later and for the initial immunization of the animal, and then an annual booster thereafter. And those vaccines are best used before the breeding season begins. As Dr. Rodning mentioned, this is an antibody-driven immunity. Antibody without additional exposure to the antigen does go away over time. And so it's a duration-dependent immunity that doesn't last as long as it would for a systemic disease like IBR or BVD. So it's important to use the vaccine according to label directions whenever it's used. Now, I should also point out that a lot of producers have, oftentimes, we find this infection in a herd around the time of weaning, maybe too many open cows at palpation, or whatever, and oftentimes producers will elect to go ahead and get a 2-dose series in those cows there at weaning and then 4 weeks later, so that they don't have to bother having to strip off the calves there right at pre-breeding and to try to get all that work done during that period of time. They can come back then and booster those cows pre-breeding one time, or maybe if they're running a pretty short breeding season, they actually are going to work their calves before the bulls go out. And so they can use a booster there at branding time in those cows and help prevent trick in that herd. I want to emphasize again that control of trick is really about a program. It's not about a vaccine. It's more about a program that includes the vaccine as the best management practice. Making sure we never get the exposure to the disease by a fence jumping bull or buying cows that are infected or a bull that's infected. is very, very important. And we have safeguards, as do most states. We in Texas have safeguards against those bulls moving into herds. But it's also very important to remember that preventing the infection also, if there's risk in the neighborhood, if we have a neighbor that perhaps has trick, or if we have a high-risk operation that maybe that moves cows in and out all the time, it's important to recognize that risk and respond to that with vaccination as a second line of protection behind good management practices for biosecurity. So an excellent vaccine that has a good place in maintaining breeding efficiency and in our good Texas herds, particularly as we begin to restock. So at this time, if you have questions, I think I'm going to hand this back to Emily, and she'll be able to direct you as to how to enter your questions.
All right, we have a couple so far. What is the recommended length of breeding season, especially when working with a herd that doesn't have a clearly defined breeding season initially?
Dr. Rodning, you want to address that?
Yeah, I would say, now, granted, I'm in Alabama, so production realities are maybe a little bit different than in Texas, but a good breeding season somewhere in the neighborhood of 60 to 90 days, I think, is a pretty tight window. There's a lot of advantages to having a tighter breeding season, a lot of management advantages, a lot of marketing advantages, but also advantages from a disease control standpoint, because things won't go unnoticed. The discussion we had earlier about the strung-out calving season, which can really it can silently steal profits from operations that have a disease like trick can silently steal profits from an operation that has a long calving season, because they might look at the books and say, well, we've got an 85 to 90% calf crop every year, but what they don't notice is that their calving distribution maybe has changed. It's skewed, as opposed to having calves born earlier in the season. They're now being born later. And so one advantage from a disease control standpoint, whether it be trick or some other disease, is that you're going to end up with a big problem the first year that trick was maybe introduced into the herd, because those animals are not going to have a chance to rebreed. You're going to end up with a bunch of open cows, but as opposed to being silently robbed for years, you can identify that as a problem and jump on it and do something about it. And while it can take several years to completely clear up a herd, if you go at it properly, you can make a substantial improvement in a short amount of time. So that was a long answer to maybe a shorter question, but I would say somewhere in the neighborhood of 60 to 90 days, depending on, are you breeding heifers, are you breeding cows, and some of the other production realities in the area. And again, that is coming from an Alabama perspective. Dr. Devin, I don't know if you have something you'd like to add to that. That's more Texas specific.
Well, I don't know. It's geographical as much as it is just remembering that the disease is only transmitted when breeding is actually taking place. And so the shorter the breeding window, if we've got everything dealt with, then we got less risk for transmission of this disease within the herd. My experience has been that typically the first year we get this disease in a herd, unless we bring in bulls from outside that are high percentage of infected, and we have safeguards for that now. But I share a situation that I got into several years ago. There was an operation that had about 1,000 heifers, and they brought in low birth weight bulls from another ranch, not knowing that they were infected, and they got exactly half of them bred. So they had to step back and clean up the bulls, sold the bull battery off, came back, and 95% of those heifers came back and bred and then carried calves on the term. So it's a disease we can deal with, but remembering that short breeding window is very important, as it just simply decreases the risk for transmission of disease laterally within the herd.
Okay, we have another question. In the bull study, did they look at the efficacy of the vaccine in infected bulls as well as trick-negative bulls?
These bulls were all uninfected at the time the challenge was made, as best I recall. We simply don't have a way to clear bulls, either with a biological or any kind of pharmaceutical, to to treat the disease.
As far as bull vaccination, would you recommend vaccinating all bulls before turn-in with cows, regardless of age?
I'm going to let Dr. Rodning give his own answer, but my answer is absolutely.
Yes. Again, if you're dealing with a situation, especially in a high-risk herd, where the introduction of trichomoniasis is a good possibility, or especially in a herd that is dealing with a current infection with trichomoniasis, absolutely vaccinate all the bulls. But stick to that 2-dose regimen initially, because it is, as Dr. Devin alluded to earlier, it is a killed vaccine. So that 2-dose regimen the first year is very important.
Okay, following up on a bull vaccination question, if a bull is infected, will the vaccine help them clear the infection?
We don't have any evidence of that at this point. And that's probably something that needs some additional study, but at this point I'm not aware of any evidence. Are you, Dr. Rodning?
No, I'm not. The immunity against the disease in the bull is much different than the immunity in the cow. In other words, the cow can mount a very effective immune response. The bull is just not quite as effective. So there's no evidence to suggest right now that vaccination in the bull will help clear an infection.
When purchasing bred females for restocking, are there any safeguards that producers should put in place to make sure they aren't bringing in any problems?
Yeah, that's a good question, and that goes beyond just trichomoniasis. And I would encourage, if a producer is going to bring in replacement stock of any kind, be sure to talk to their local veterinarian and get a game plan on how to quarantine those animals. What are some diseases of interest that we need to test for, based on where are those animals coming from, what is the health status of the herd of origin. But with respect to trichomoniasis, certainly purchasing bred replacement females, especially bred replacement females that are in the second or third or even third trimester, is going to be much safer than buying than buying females earlier in gestation that may be harboring the organism and that just haven't exposed or haven't aborted as a result of the previous exposure. But certainly keeping those animals separate, cabbing them in a separate area, maintaining the integrity of those replacement females, even through the subsequent breeding and calving season, just allowing time for any problems such as trichomoniasis or other infectious diseases to manifest themselves. So having an appropriate quarantine time would be very appropriate.
Yeah, I would agree with Dr. Rodning that the quarantine is very important. Getting through one breeding season, keeping those cows that are purchased separate from retained cows, and purchasing cows that are at least 120 days of gestation is pretty important, I think, as well. Most of the abortions with trick occur before that time frame. Usually they're between 70 and 90 days, although we do have some cows that will abort later on in gestation. But that cow that's at least 120 days bred is a much safer option.
Is there any current trick research ongoing? And this is the last question I have in the queue, so if there are any other questions that anyone might have, please send them in now. So again, the question is there any current trick research ongoing?
Dr. Rodning, that one's yours.
Yeah, there is quite a bit of trick research out at University of California at Davis, and we're also involved, along with several other universities. I can't speak to the details of what all they're doing, but we are currently involved in some trick research here at Auburn University, looking at some different control, prevention, and different vaccine strategies, looking at the reevaluating the efficacy of the vaccine. A little premature to discuss all the detail or any details of that project, but yes, there is a lot of interest in this disease over the past, I want to say, 5 to 10 years. The interest in trick has just skyrocketed. So there's a lot more interest in the disease right now, a lot more people engaging in research, both from a vaccine standpoint and from a diagnostic standpoint, a control standpoint. So yeah, there's quite a bit of research ongoing currently with trichomoniasis.
Great. Let's see. We have another question. With threats of trich, it appears that a preg check is essential. Are producers doing a more thorough job of preg checking their herds?
There are actually, that pregnancy diagnosis is a great reproductive management tool, and one that is not used as often or as much as it should be. But certainly, the one advantage of pregnancy diagnosis at the producers and their veterinarians to identify problems earlier and then deal with them before the calving season and before the subsequent breeding season, before the get things in order and to fix the problems. And there's a large number of reasons why reproductive performance suffers, some of which are infectious, some of which are not infectious, but they need to be dealt with sooner rather than later. And so one advantage of pregnancy diagnosis is that, one, it allows you to identify those cows that are open, and so as soon as those cows wean their calves, they need to be heading off the farm because they're utilizing resources that could be put to other more productive animals. It also allows time to plan for the calving season, to get an idea of the general distribution of calves that are going to hit the ground, and then it simply allows you to identify whether or not you have a problem. Are things rocking along just fine, or do you have a reproductive problem that needs to be dealt with now? Because the sooner you deal with it, the better off you're going to be.
I think there's another thing, given the drought conditions that we faced in the last couple of years too, is getting a pregnancy diagnosis and even going beyond that and being able to stage those pregnancies allows us to divide those cows up where we can supplement them according to their stage of gestation. The demands of growth of that fetus are much greater in the third trimester than they are in trimesters 1 and 2. And so being able to manage those cows supplement-wise, protein supplement and use of available forage, there's some dollars to be saved there by palpating those cows and managing that those limited feed resources very carefully.
Great. I don't see any more questions coming in, so I just would like to thank you for your time from both the people joining the webinar and Drs. Rodning and Devin. We really appreciated you attending with us today. And again, if you have any follow-up questions or if you would like to schedule a follow-up interview, please contact Lori Maud. And again, we have her information up on the screen. So thank you, and everyone have a great day.